My name is Helen Pearson. I am a nurse and researcher and the chief investigator for the Redmapp study. The aim of the Redmapp study is to develop a decision aid which will support parents in making repeated treatment decisions when their child has relapsed neuroblastoma. This study was developed based on my clinical experience of working with parents of children with relapsed neuroblastoma. For relapsed neuroblastoma, there is no standard treatment protocol, but many treatment options available. Parents are faced with making a series of repeated decisions, and these are often revisited depending on the child's response to treatment. From my experience, parents want to be involved in making these decisions, but it can feel burdensome making these decisions repeatedly. Some parents can experience regret in the decisions which they make, and there is a huge emotional component to making these decisions. There has been much research on parent decision-making within paediatric oncology, but this is focused on single events, for example withdrawing care or opting for clinical trials. There is no research which has looked at decision-making for parents who are making a series of repeated treatment decisions and how that decision-making may change over time. When decisions are complex with uncertain and variable outcomes, such as in the case of relapsed neuroblastoma, it may be that a decision aid can support parents in making these decisions. Decision aids are used within adult cancer care, and they have been evaluated to show that they increase confidence in decision-making, they can facilitate discussions with healthcare professionals, and they can reduce decisional conflicts and regret. To understand decision-making from a parent perspective, we need to hear the voices of parents who are making these treatment decisions for their child right now. The purposes of a decision aid are to provide information on the options available and what factors an individual may want to consider when making a decision. This information can then be used to facilitate conversations with the healthcare professionals. The Redmapp decision aid will follow the International Patient Decision Aid Standards. These standards provide a systematic development process meeting a specific set of criteria to ensure a robust and transparent development. It is important to note that a decision aid does not tell a person what treatment option to choose, but can be used as a tool to support a person's thought processes and factor in considerations that will improve their overall decision-making. In order to develop a decision aid, the Redmapp study will first seek to understand how parents make repeated treatment decisions and how their decision-making may change over time. The study will consist of 2 phases. In phase 1, parents will be asked to participate in an interview with me, the researcher, to talk about their decision-making experiences. The interview discussion will be around what's important when making these treatment decisions, who's involved in making these decisions, and do the factors which are important change over time. These interviews will provide an insight and understanding of parent experiences to inform the decision aid. In phase 2, the decision aid will be developed. A group of parents and healthcare professionals will be involved in the development process. This collaborative working is essential to ensure that the decision aid can be integrated into clinical practice. Once developed, parents and healthcare professionals will test the decision aid to assess how easy it is to use, understand, and check that the language, content, and design is appropriate for parents. The decision aid will then be ready for use in clinical practice. When change is implemented, it is important to evaluate its effectiveness in clinical practice. Therefore, the decision aid will require ongoing evaluation and adjustments to ensure it's fit for purpose and meets the needs of parents who are making repeated treatment decisions. By listening to parents now, we hope to be able to enhance the care and experiences of children and their families who will be making these repeated treatment decisions in the future.